Welcome back. From the deep, dark hole to a mission shining a light to help others, a Boston Recovery Center is making a huge difference in the overdose crisis, one person at a time. Jessica Brown with the news support to help even more people on the other side of addiction.
So when you're stuck down in a deep, dark hole and somebody shines a light and puts a pathway for you to get out of that hole, it's your obligation, your responsibility to be that same light for somebody else to come out that hole.
Lovely Harvey knows about the deep, dark hole. He lived it.
Homeless, helpless, hopeless, and not caring about tomorrow. I ended up in the wheelchairs, in the hospitals, in the prisons, the overdoses, everything that could go wrong that adds up with active addiction is my story besides dying. And I came pretty damn close.
Harvey knows he could have been a statistic if not for one man and one program in the heart of his community.
Mr. Davis used to walk by me and see me in Nubian, killing myself every day, using substances, and would say, you know, it's okay to come home.
We have recovery meetings here.
Home was Metro Boston Alive, and Mr. Davis is Gregory Davis, a man who has helped thousands of people just like Harvey find their way out.
Ron Hill was my first person I mentored in his journey of recovery.
Davis remembers all the names, all the faces, people he helped and people who may be gone.
We provide clinical care.
Now, through a partnership with Mass General Brigham, he's expanding that effort.
And they wanted to really start to put some focus on the community of color that has been really invisible for many years in terms of getting resources and support.
Building trust wasn't easy, but Davis says when MGB sent their mobile health van right into the Roxbury community, things started to change.
I can say to someone, you know what, you need to go in that van because did you get your blood pressure done? No. Did you do this? No. Go in that van right now. It's a small but powerful step. It's not the solution, but it's towards the solution.
Why aren't people?
Jasmine Irvin has been a key part of finding that solution. The Dorchester and Roxbury native is the senior program manager for the substance use disorder health equity team at MGB.
We saw the horrible numbers, health outcomes that were happening in our community, particularly around substance use disorder. So we knew that we had to do something.
She knows getting her team into the communities that need them most was critical.
So it's really boots on the ground, like getting in here and rolling up your sleeves and doing the work, touching a lot of people who we may not ever come into contact
Absolutely.
with.
Lovely Harvey has seen what this partnership can do and says it makes all the difference.
Many lives have been saved and changed because we meet people where they're at.
Well, Jasmine Irvin, who you saw there, said they're just getting started. Her Mass General Brigham team really wants to increase that visibility in Boston's black and brown communities, bringing that help to their front door. Metro Boston Alive, by the way, has helped some 20,000 people out of addiction over the past 4 decades. You can learn more about their incredible work with this story on our website and WCVB app. I'm Jessica Brown, WCVB News Center 5.
And thanks, Jessica, for bringing us that story. So each year, billions of dollars in aid for people in need goes unclaimed. Learning how to navigate the system and plow through paperwork, though, can really be the difference maker. Joining me now is Dr. Alistair Martin, an ER physician at Mass General and founder and managing director of Link Health. How are you today? I understand you came to us right from your overnight shift at the ER. I'm glad you're here today.
That's right, Karen. Great to be here.
All right. So, Dr. Martin, explain to us what Link Health does and how it breaks down barriers to accessing programs.
That's right, Karen. So, you know, in my job in the emergency department, what most people think of is, you know, they think about Grey's Anatomy. They think about George Clooney in ER, you know. But the reality is what they don't see are the faces of poverty. You know, that young mom of 2 who has 3 jobs and has to decide where she's going to take her kid when the pediatrician's office is closed. Or the homeless man I saw last night whose birthday it was, who had nowhere else to go. You know, these folks are living paycheck to paycheck, and they're making decisions every single night around do they take care of their food, their rent, or do they take care of their medications and their copays? And so what we do at Link Health is we help people enroll in things called cash assistance benefit programs. SNAP, WIC, rental assistance, utility assistance, all of these programs that they qualify for but maybe have not submitted the applications for. We meet
Or
them,
don't know that the programs exist.
That's right. We meet them right there in the waiting room, and we enroll them in these different programs. So by the time they leave with money in their pocket.
What role do students play in this LINK program?
Yeah, you know, it's one of the things I'm most proud of, Karen, this idea that we work with pre-medical, pre-nursing, PA students, and we train them on how to do these enrollments, how to have these conversations, and how to submit these applications on behalf of patients. So not only are we helping patients achieve this new financial stability, we're also helping these students gain a new skill set that will help them in their healthcare careers.
The Congressional Budget Office estimates that 4.8 million people will lose coverage when the new Medicaid work requirements take effect, but it's not because they don't have jobs. It's about the paperwork.
You got it. It's the opacity of the system. You know, this bureaucratic nightmare that we're going to have patients run into is going to mean that so many of our patients are going to get kicked off of things like Medicaid or SNAP. And that's where we come in as Link Health. We help people cut through that paperwork, get them those requirements, and make sure that they have all the documentation they need to get these benefits that they qualify for.
Now, do you keep up with the patients or you just get them started?
That's right. We absolutely do. Yeah. So we follow up with folks, and it's not just about submitting the application. It's about making sure that they actually receive the money, and if they don't, trying to work with the state and the city to figure out what went wrong.
So what motivated you to start Link Health? I mean, was there a patient or an experience that inspired you?
Look, every night I go into the emergency room, what I see are the faces of failed policy. You know, folks who are struggling to just make it in this city. And at the end of the day, there's only so much that I can do in the four walls of my ER. And I worked in government for a stint down in DC, where I came to find out that there's about $142 billion in these very programs that goes unused every single year. And I started to think, well, gee, what would a program look like if we could connect the dots? And that program is Link Health.
Now, you talked about some of your experiences with patients, and of course, you're humanizing the process and and what it takes to help bridge gaps. But what about AI? What impact is AI having, and internet access in general? How does technology play a role in access to this information?
It's a great question. Look, at the end of the day, these applications are asking the same questions, Karen. They're asking your name, your date of birth, your age, your address. So what we do is we use artificial intelligence to help us with some of the sort of bureaucratic aspects of these applications, reducing the redundancy, making it easier for our navigators to get these applications submitted. And we've been able to, with the use of technology like artificial intelligence and our navigators, submit over 4,500 different benefit applications. And that's resulted in $5 million dispersed to patients in need. $5
million, that's a lot.
Yeah.
So it's clear how Link Health helps individual patients, but is there also a societal benefit?
Such a good question. Such a good question. At the end of the day, look, if a patient has nowhere else to go, right? If they're struggling with a cough that might be pneumonia or shortness of breath that might be heart failure, if they've got nowhere else to go than the emergency department, guess what happens? The emergency room wait becomes longer and longer and longer and longer. When we give patients options, things like primary care, things like telehealth.
And we pay for emergency room care.
You got it.
Through our health system, through our health plan, right?
You got it.
Right.
And so at the end of the day, what we're doing here is by providing financial stability, we're actually lessening the strain, the burden on places like emergency rooms, so that when you have an emergency, we can actually take care of you and not have to have you wait 8 hours, 9 hours, 10 hours.
Wow. Dr. Alistair Martin, you're doing great work over there.
Thank you so much, Karen.
All right. Thank you for joining us. Oh boy, living without pain for the first time in decades. The first patient in Massachusetts to get a breakthrough treatment for sickle cell disease that literally changed his life.